Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning. Today's topic is Mon General's Wound Healing Center. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, James.
The Wound Healing Center, Mon General's Wound Healing Center, and Dr. Roger Barclay is a physician on staff at Mon General, and you can usually find him at the Wound Healing Center. But I thought a hospital was a wound healing center. So this is a separate building than Mon General Hospital. What's the focus here at the Wound Healing Center?
We deal with many hard-to-heal wounds. Frequently, diabetes and circulatory issues play a role. As the population ages, we're seeing more and more of these kind of wounds.
Because diabetes, those that are diabetics, it takes wounds longer to heal, or it's more difficult for them to heal, correct?
That's correct.
Okay, so are people usually referred to the Wound Healing Center, or should we just check ourselves in there?
We get referrals, but you're able to self-refer. Anybody who calls can be seen. A referral is not necessary. Anybody can self-refer to the Wound Healing Center.
Where are you located?
We're at 200 Wedgwood Drive. It's the Medical Arts Building. It's just next to the Morgantown Internal Medicine Group, where the cardiology group is located. There's a good, large parking area and easy access for disabled patients.
Now, you're an internal medicine physician with your own private practice. Do you do this periodically, go into the wound center? Is this 100% of your time?
No, it's about 40% of my time. I see patients at the Wound Healing Center 2 days a week.
And for what type of wounds are we talking about?
Well,
because the reason I asked this, just recently, I know somebody that was burned very badly, and they went in. And really, burns is a whole separate thing, correct?
Yeah, a burn is a kind of a wound. It's a thermal injury. A frostbite is another kind of thermal injury, and the treatments are similar in many cases. I'd guess roughly 30% of the wounds we see are related to diabetes. 30% are from vein problems, and 30% are from arterial problems. Of course, there are mixed etiology wounds. You can have factors from all kinds of medical conditions that contribute to the development of a wound.
How does a diabetic lose a toe or a foot? What's the progression there? How does it happen?
Well, there's several things that contribute. One of the worst complications of diabetes is neuropathy. The fine nerve fibers that give us sensation are affected when the diabetics don't have good control. Over time, they lose function of the fine nerve fibers and classically develop numb feet. That predisposes diabetics to injuries when they have an ill-fitting shoe and get friction on a toe. They can develop a wound and not have any sensation. So once that process starts, there's other factors that contribute. When your blood sugar is over 200, the white blood cells that have a big part in fighting infection don't work as well. Also, frequently diabetics have circulatory issues. The fine capillaries that deliver blood to the tissues can be affected, and it's a whole cascade of events that contribute to what are called neuropathic, or penetrating ulcers. And they're very difficult to treat.
So wounds on the feet, they just don't feel them.
The diabetics frequently that is the problem. They can get a wound and not even notice it. I had a man who went to a hot tub and put his watch in his shoe, and then didn't realize his watch was still in the shoe a week later, and had a substantial wound from that by virtue of the fact that he just had no sensation in his foot and he didn't feel the watch was still in his shoe.
Wow, I had never heard of anything like that. It could also be, if you have dry feet, you get a crack. Those cracks can go pretty deep on the bottom of the feet, right?
Yes, of course.
Okay, so if a wound goes untreated, when does it come to the point where a toe is amputated or a whole foot is amputated? Because
Well-
I thought if you had an infection in a wound that your body would tell you in some other way via fever or some other signal that you have an infection.
Well, not always. I mean, the body can fight it off to a degree, and you can treat infections with antibiotics. If you have circulatory issues, there's sometimes the arteries that supply blood to the feet can be opened up with balloons and stents, very similar to what's done with the heart conditions and blockage in the arteries that supply blood to the heart. It's very important to use proper footwear and offload any wounds, and there is a variety of appliances and boots that are constructed for this purpose that help prevent pressure on the affected areas of the foot.
Okay, so why amputate?
Well, unfortunately, gangrene can develop. Gangrene is a situation where the tissue is not viable, which is it's just not able to maintain. The tissue dies, and it releases all sorts of toxins into the bloodstream and is prone to infection. In that setting, it's not compatible with life to have a piece of tissue attached to your body that is dying or dead.
And that brings up a follow-up, Jim, that I wanted to ask about, because the information that was sent to us, and it says, the methods employed by the center have established an impressive record of healing wounds that others thought hopeless, including many that had required amputation. What do you do at the wound center over and above other things that are happening out there?
I think the wound center tracks wounds. The electronic medical records are very helpful in that regard. Every wound is measured and pictures are taken. All kinds of therapeutic approaches are used, including diet, nutrition, treating infection, debriding off dead tissue, offloading. Any kind of circulation issue is corrected, and sometimes with the diabetic wounds we can use hyperbaric oxygen.
Explain that.
Well, it turns out that there are certain wounds, not every wound, but there are certain wounds that can be treated by putting a patient in an atmosphere of 100% oxygen under pressure. We generally put people at 2 to 2.5 atmospheres of 100% oxygen in a chamber, which is a tube constructed of clear plastic. Patients stay in these chambers for 2 hours, and it allows the development of new capillaries. Angiogenesis is a term used that is the growing or the formation of new capillaries that will heal wounds that are difficult to heal.
Can you catch that, and if you see what direction this patient's going in, and start that process?
Yes, you were the Medicare guidelines require us to treat wounds conservatively for 30 days with all the other treatment modalities before we can start hyperbaric oxygen. It's not something that's used for every wound. Most wounds heal without it, 100% oxygen. It's only for the very difficult to heal wounds that it is used.
The hyperbaric chamber, 2 hours in there. One size fits all? You don't have an extra large to get me in if I need it?
There's only one size, but they can accommodate most of us.
And is my head sticking out and I can text and watch television and eat?
No, you can watch television, but you can't take any devices into the chamber.
What have you seen the chamber? What's the most impressive thing you've seen it do?
Well, it can heal wounds that have not healed for a year or two, and there are wounds caused by radiation therapy that can be very difficult to heal. The diabetic wounds, there are pressure ulcers. There are some circulation issues that can cause chronic open areas that are prone to infection and cause all sorts of problems. And there have been success stories using the hyperbaric oxygen. It's a technique that's been used for some time.
304-296-0041 is our number. If you have any questions about the Wound Healing Center, or perhaps you have some testimony you want to talk about how they healed your wound. 304-296-0041. Back after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
I'm going to go out on a limb that if you're in the hyperbaric chamber, you can't smoke a cigarette. They probably frown on that, all that oxygen.
Well, you can in bars anyway, so it all kind of just goes together,
But Dr. Barclay is our guest, Dr. Roger Barclay, and I think that's an interesting story you were telling during the break about those pocket warmers that have a little butane flame in them, and somebody somewhere was in a chamber with
not here, not
had
here.
one of these pocket warmers in there, and 100% oxygen didn't end up too well, did it?
No. But of course, that's we need not dwell on that. That's not going to happen.
No, but talk about the precautions that you do take.
Well, we are very strict with precautions. You have to disrobe and put on a scrub suit, and we assure you don't have any petroleum-based products on the skin, which conceivably could be a problem.
Vaseline.
We cover it with gauze.
Yeah, because Vaseline's a petroleum-based product,
yes,
right? So,
yes.
What other precautions?
Frequently there are some issues with barotrauma. You can get a sinus squeeze and feel pressure in the front of your face or your ears. You can get some pain at times. I'd say about 5% of the times it necessitates stopping the procedure and referring a patient to an ear, nose, and throat physician and putting in pressure equalization tubes. It's pretty much the same thing that children get when they have frequent middle ear infections. There's just a small tube that's put in the ear that eventually falls out and doesn't cause any damage, but that can equalize the pressure.
Isolated cases.
Yeah, probably less than 5%. So sometimes that's an issue with people.
I'll relate a little bit of my own experience with the Wound Healing Center because I went to Mon General Hospital with a wound on the bottom of my foot. It was a crack as my feet were dry, and they referred me to the Wound Healing Center. You come in, and the first thing they do after they get your information is offer you a drink. I mean, you can get juice, you can get coffee, you can get some water. And I thought that most wounds would heal on their own. In other words, if you have a crack or an open wound, I thought both halves of the split would come together and start melding together like the human body's supposed to do. But at least in my case, it was in a difficult place because I'm walking on my feet all the time. It was hard for that wound to heal, so you put me in a moon boot, among other things, to kind of keep the pressure off the bottom of the foot. But I noticed that every week when I went in, you checked on the progress. You had me put some kind of cream on there. Talk about how you go about dealing with a difficult wound like that on the bottom of a foot when we're having to walk every single day.
Well, frequently the most important part of the therapy on the foot is offloading and trying to design an appliance or boot that distributes the pressure to other parts of the foot and try to limit your time walking or on your feet. The podiatrists, of course, are very helpful in this regard and are very skilled at customizing orthotics and other kinds of appliances that keep the pressure off the areas of the foot that are prone to that kind of wound. We work on nutrition. If there's infection, we treat infection. If there's circulatory issues, we work on circulatory issues. If there's dead tissue, we can debride it. When you have dead tissue related to a wound, it can secrete various toxins, and that slows down wound healing. So we can use scalpels and curettes and various instruments to take off the dead tissue. After the area is anesthetized with topical agents.
Does Neosporin, the over-the-counter Neosporin that we can get as regular people in a drugstore, does that work?
Yes, of course. It can help infections and provide a moist wound healing environment. The combination topicals sometimes, and especially Neosporin, contains neomycin, and that agent sometimes can cause an allergy in up to 5% of people. But bacitracin, Neosporin, Polysporin, there's over-the-counter preparations that are helpful to provide antibacterial activity and create a moist wound healing environment.
So you want moist?
Yes.
Okay.
How will we know about you besides this show and getting the word out? But do doctors refer us
yes,
to the wound
yes.
center?
This is the surgeons that have wounds that aren't healing will refer us wounds. Patients can refer themselves. It's not necessary to have a referral. Most wounds do, of course, heal on their own. The wound healing center is for the difficult to heal wounds.
And we want to talk about the staffing of the wound center when we come back.
We will be back in just a moment here on WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Another way the Wound Healing Center lets you know about their services, big billboards I've seen on the interstate. I've seen Dr. Barkley on a billboard or two. And
The
your
radio
staff.
works better.
And your staff, really a great staff. I like the big guy that's a nurse. He's a friendly guy, but I like all the people that you have working in there. Talk about your staff a little bit, and you're not open 24/7, are you?
No, it's regular business hours for the routine things. If there are emergencies, such as carbon monoxide poisoning, we're open. One of the roles that the hyperbaric oxygen chamber plays is the treatment of carbon monoxide poisoning, and we're this time of year with the furnaces active, that can be an issue. So so far it hasn't been this year, but there are emergency situations where the chambers are utilized.
And tell us about your staff.
Well, we have a staff of registered nurses. I think we have 5 now. There's aides and LPNs, as well as clerical or receptionist staff. We have a director. The RNs are very skilled. They attend continuing medical education classes in wound healing. A group of them are going up to Sewickley, Pennsylvania tomorrow to get some training with a kind of new vein treatment that so many of our wounds are related to problems with the veins that there's a new technique involving laser ablation of varicose veins that is going to be very helpful in the near future.
Yeah, and I'll tell you, there's never, at least for me, been a long wait in the waiting room like you get at some doctor's offices, and it's just real friendly in there. Once again, I'm going to give you the phone number here if you want to write it down for more information, but they are located at 200 Wedgwood Drive. This is the driveway that's just right on top of the hill on Van Voris Road, the big hill. So once you get up to the top and before you start going down towards the district in that area, down in there, that's where you're going to find them. And they are located, again, on Wedgwood Drive, Suite 200. The telephone number is 304-285-1460. So write that down. Put it on your refrigerator. You never know when you're going to need it, 285-1460. Or you can do what I did. I went to Mon General, and they referred me to the Wound Healing Center. Mon General brings you Health Talk each and every week here on WAJR Thursday mornings. Dr. Barkley, thank you so much.
You're welcome
for being on the program.
It's great being here.
And Greg, thank you for everything you've done.
Thank you, Jim, and for all the contributions you've made this morning.
I don't know. You sound sarcasm
I
every
feel
day.
all warm inside. I don't know.
Sorry, I forgot you, Kay. Good
It's like
job.
you're in a
That's all right.
hyperbaric chamber, isn't it? All right. Now, you've been listening to Health Talk, brought to you by Mon General. Stay tuned for the news next on the Voice of Morgantown, WAJR.